So talk to me about telecom industry. In telecom industry, when we're looking at the data, we're also creating opportunities to understand our customers, what their behaviors are, what their patterns are. Do you also have some similarity between telecom, understanding your customer well, in healthcare as well?
It's interesting. I was in telecom in the late 90s and the early 2000s. And at the time, we were a really innovative industry. We were coming up with things like the ability to get data remotely. Wireless was just coming into the fore. Broadband was a big deal. Wi-Fi in offices and homes was really exciting at the time. And I think healthcare is really the innovative industry that's out there right now. The ways that we're thinking about making data accessible to our physicians, the way we're engaging with our customers, the way that we're starting to use artificial intelligence to guide the care, it really is exciting in the way that I see telecom was 15 and 20 years ago.
I tell my students when I'm in the class that think about telephone 10 years, 15 years back. And if somebody told you that, we're going to use telephone only 5% of the time and use 95% of the time to learn about our health or about where we are going or other applications, people would laugh at us.
True.
And now we're using telephone for, everything else,
Yeah.
but really making calls.
Who could have seen the rise of smartphones and the way that we're using them? Just as an aside, there's a popular sci-fi movie called Blade Runner, and it was set, I think, in 2017 or 2018 when it came out in 1982,
That's
and
true.
cars are flying around and they're cyborgs, and yet when they need to communicate with somebody, they still walk to a payphone in this movie. So they couldn't anticipate that 30 or 40 years in the
That's
future,
true.
we'd be doing telecommunications in a non-fixed way. Similarly, whether it's in healthcare or any other industries, it's really tough to get out of the mindset of the way we operate. And you're right, I don't think that 5, 10, 15 years ago we would have thought that our phone would have been the way that we wanted to access our medical record.